Hello, and welcome to the EMS Systems Design Unit 7 assignment. I'm glad that you guys are here for this program proposal. So our obligatory objective slide, we want to introduce the community paramedicine or the pre-hospital community paramedicine program to you today. I want to let you know how we got to the solution of the CP program, what the impact of that program is going to be. We're going to evaluate the program or tell you how we're going to evaluate this program, give you a summary, and then provide some citations information that we provided throughout this PowerPoint. Just an introduction to the city of Rogers. We are located in the heart of Northwest Arkansas. The Rogers Fire Department is the primary 911 medical and fire service for the city of Rogers and the city of Little Flock, just adjacent to the city of Rogers. We're approximately 72,000 nighttime residents during peak volumes, summer breaks, holiday seasons, shopping seasons. That number can swell to around 100 to 110,000. We are a destination city. There is a little bit of everything here for just about anyone of any particular ethnicity or genre of whatever they would like to participate in. We've got anything from bike trails and walking paths to the Walmart Music Pavilion to the Aquatic Center to shopping. It's really a first-class city, and if you can't find anything here to do, you're probably not looking in the right spot. So it is a destination city. Our department runs approximately 5,500 medical calls each year, of which we transport about 4,000 of those calls. So the program that we're talking about today that we want to implement is a community paramedic program. The goal of any community paramedic program needs really to be fitted to the community that it's going to serve. There's not one size fits all community paramedic program. Each city and each community is just a little bit different. And so the goal of those programs should be fitting to the city or the community that they serve. For our program here, we really want to focus on enhancing the care to the citizens within the city and those that work and play in our city. We want to reduce non-emergent 911 responses and non-emergent emergency room visits through this program. And we want to reduce readmissions to our emergency room and our hospitals. All of this has huge impacts if we can get that done. So how did we get here? Well, first off, the Rogers Fire Department conducts strategic planning sessions each year. Some years, the even years, we will conduct those sessions with the department as a whole, and on the odd years, our command staff gets together and conducts those strategic planning sessions. Those strategic planning sessions are used to drive fire and EMS development in the fire department and really helps direct where we're going and how we're going to get there. As a note, we also participate in ambulance accreditation called CAS. That happens every 3 years, and it's really a continuous improvement model that also helps us direct our EMS care and keep us on the cutting edge of medical care for the community. Over the last several months, we've analyzed data from the last 10 years of EMS calls. We've noticed that we have an increased operation cost for our ambulances. We've noticed that we've got an increased wall time, or in layman's terms, we wait at the hospital a lot longer than what we used to. We've increased system demand for non-urgent calls, so those folks that probably don't need to go to the hospital and they probably don't need an ambulance to come and get them, we've seen an uptick of those. And with the collaboration of both of our local hospitals, we've noticed that there is an increased readmission rate to both of those hospitals. So what's going to be the impact of this program should we get it implemented? Well, first, for it to be successful, we're going to have to train our individuals. And at a minimum, we really need 6 people trained to that community paramedic level, and we'll talk a little bit more about their training in just a few minutes. Funding is going to be a huge impact for this. Initially, we anticipate an increase in funding needs from our city. that would likely come out of a general revenue budget. But we think that we can get reimbursement through many different avenues. We can get very creative to this. It can be as simple as reimbursements from Medicare and Medicaid, private insurance, and then we can kind of get creative and think that we can get a 10% cost share from our or reduction of hospital readmission rates. We know through an ESO study that many states today cover community paramedic visits under their Medicaid and Medicare programs. And you can see that in the citation that we'll show you in just a little bit. Going back to the readmission rates, though, each hospital, if they do get readmitted within a certain time frame, they don't get a complete reimbursement of the claim. With us being able to reduce those readmission rates, they're going to save a lot of money, and we're hoping that we can get 10% of that savings that they see. The schedule of our community paramedic program, again, is going to be based on our needs, but initially, we anticipate it running 7 days a week, 365 days a year, between the hours of 9 a.m. and 6 p.m. But we're also going to have to analyze data and make sure that those hours work for our community. So if it doesn't work for our community, we are going to adjust those hours based on the needs and the volume that we see through the program. To positively impact this community or our community, we're going to look at things like reduced readmission rates, increased reliability in EMS services, and net zero cost burden to the city through, again, creative reimbursement methods. Those are going to be positive impacts to the city, and we think we can get there. To the department, initially we're going to have an increased cost for new equipment, new vehicles for these community paramedics to get to the calls that they need to go to. They're going to have specialized equipment, and that's going to be an upfront initial cost that will decrease over time. The training that I mentioned earlier, we want them to be college educated and have a degree in community paramedic. The department's going to have to pay for that, so that's going to be a little bit of an upfront cost. We want to be a licensed community paramedic program within the state so that we can access those reimbursement rates through Medicare and Medicaid. And we want to provide a little extra training in case management and interagency interaction so that we can do the best for the citizens that we're serving. Impact to the city. We're going to increase reliability in EMS services. So the fact that we can reduce the call volume for non-emergent calls means that that ambulance is going to be there when we have a time-sensitive critical diagnosis patient that actually needs that ambulance. We're going to increase the level of care by, again, making sure that the ambulance is available when it's needed, and then also provide that case management and that interagency interaction so that we're not just going to somebody's house to care for some needs, but we can actually direct them and get them to the agencies that they need to see. And then hopefully after 5 years, we can be net zero cost to the city. Our hospital system, we want to reduce the emergency department visits, reduction of readmission rates within 48 hours, and decrease our ER wait times and wall times. That again will help make sure that our ambulances are reliably in service for the citizens when they need them. How are we going to evaluate the program? Well, first off, data is what will drive this evaluation process. We've got to have data to ensure that the program is successful. So we're going to take that data every 6 months, and we're going to compare it to the data of the previous 6 months without that community paramedic program. And hopefully, we will see through a quantitative evaluation that we do see reduced readmission rates. We do see increased reliability of our ambulances. We do see increased reimbursement rates both for us and our hospitals. And some of the data that we want to collect to ensure that our program is working, we want to look at the number of calls that our community paramedicine program is accepting and processing. We want to work with our hospitals to see what the readmission rates are. We want to look at time and day. What times of days are our calls coming in? What days of the week are we getting more calls? The type of calls that we're receiving through the community paramedicine. And then also the cost of those calls. Not only the cost of the call, but what also would the cost have been if we didn't have a community paramedicine program in place. We want to design and deploy healthcare outcome surveys. And we want those to be completed by both the caregiver or the community paramedic, and also the patient. This will help us drive that service line and really improve that service line so that we do enhance the care to the citizens that we're serving. Our goal is to have a 90% completion rate. Now, we're not naive enough to think that we're going to get that right out of the box. So we're hoping that within the first year we get a 75% return of survey rate. And then incrementally, we expect that that will go up to 85 or better in the following years. We want to do a SWOT analysis each year that this program is running and review those strengths and weaknesses. After we do that, we want to develop processes and procedures to improve the weak areas in the program. We want to reinforce those strengths that we're doing really, really well. And especially in the first year or two, we want to celebrate small wins and make sure that people know that the program is being successful. In summary, healthcare costs in the United States is in the rise, or on the rise. Not just a little bit, but a lot. And it's going to be significant if we don't address it soon. Non-emergency call volume is on the rise. Non-emergency ER visits are on the rise as well, and readmission rates are through the roof. This program, once successfully implemented, will reduce all of these over time. We want to improve pre-hospital care through the use of our CP program, provide resources to those patients that they currently don't have. We are anticipating an initial uptick in cost for equipment and manpower, but we do think we can be net zero cost in 5 years. We want to improve reliability, 911 ambulance response, especially for those folks that need it when they need it. Cost sharing and reimbursement through creative funding mechanisms like we spoke about, and providing improved resources to the community members when they need it. With that, I'll take any questions. This is kind of a word map of our program here. And then here is our citations that you can see there.